Unlock your mind's hidden potential by mastering the secrets of your own brainwaves. This journey explores how understanding these neural rhythms, backed by real stories and practical guides, can empower you to achieve learning goals previously deemed impossible. We will delve into the science and application, transforming abstract concepts into tangible tools for cognitive enhancement. Prepare to discover the keys to unlocking unprecedented learning potential through the power of brainwave knowledge. Fundamentally, brainwaves represent the collective electrical activity generated by billions of neurons communicating within your brain. These rhythmic pulses are the symphony of your thoughts, emotions, and physiological states, fluctuating constantly based on what you are doing or feeling. Scientists observe and measure these faint electrical signals primarily using non-invasive techniques that detect the patterns from the scalp. This measurable electrical brain activity originates from the electrochemical changes occurring as neurons transmit signals amongst themselves. Each individual neuron generates a tiny electrical discharge when it fires, sending a message to its neighbors across a synapse. It is the summed, synchronized electrical potential changes across vast populations of neurons near the detector that creates the electrical signals we register as brainwaves. These measurable rhythmic patterns arise because groups of neurons often discharge in synchrony, creating neural oscillations. Imagine thousands of tiny batteries firing in a coordinated pulse. This collective action amplifies the signal, making it detectable outside the skull. The specific frequency and amplitude of these oscillations reflect the coordinated activity within different neural circuits, underlying various cognitive functions. The synchronized firing of neurons is absolutely crucial for brain function because it allows for efficient communication and information processing across different brain regions. Synchronization binds together populations of neurons working on a common task, facilitating processes like perception, attention, and memory formation. This coordinated activity is precisely what generates the measurable brainwaves, reflecting the underlying neural communication architecture. To capture these intricate brain rhythms, scientists primarily use electroencephalography, universally known as EEG, a technology that records brainwave activity through electrodes placed on the scalp. These electrodes detect the tiny electrical voltage fluctuations resulting from the synchronized firing of neurons beneath. EEG provides a direct, real-time window into the brain's electrical symphony, mapping the ebb and flow of neural oscillations. A fascinating EEG history nugget reveals that physician Richard Cadone first reported detecting electrical activity from the exposed brains of rabbits and monkeys back in 1875, long before human EEG was established. His early discovery, using a sensitive galvanometer, provided the first concrete evidence that the brain generates its own electricity. This groundbreaking work laid the foundation for Hans Berger's later development of human electroencephalography in the 1920s. During a typical EEG procedure, electrodes are attached to the scalp using conductive paste, and the individual might be asked to perform simple tasks, rest, or sleep. Significant challenges in getting clean data arise from muscle artifacts like blinking or clenching the jaw and electrical interference from nearby equipment. Meticulous preparation and sophisticated filtering techniques are essential to isolate the true brainwave signals from this noise. While EEG is the most common tool, other methods exist to measure or infer brainwave states, offering different perspectives beyond EEG. Magnetoencephalography (MEG) detects the tiny magnetic fields produced by electrical currents in the brain, offering better spatial resolution than EEG. Additionally, functional magnetic resonance imaging fMRI, while measuring blood flow, can show brain regions whose activity correlates with specific brainwave patterns observed simultaneously with EEG. Decoding EEG signals involves analyzing their amplitude, the signal's power or intensity, and frequency, the speed of the oscillations, measured in hertz. High amplitude often indicates strong synchronicity among neurons, as seen in deep sleep, while higher frequencies are typically associated with active processing and wakeful brain activity. The specific combination of amplitude and frequency provides crucial clues about the brain's functional state. Scientists differentiate meaningful brainwave patterns from random electrical noise using sophisticated signal processing techniques and statistical analysis. They look for recurring rhythmic signals that stand out above the background noise level and correlate these patterns with specific cognitive states or experimental conditions. Consistent replication across subjects and studies helps confirm that a detected pattern is a genuine neural signal related to brain function, not just electrical noise or artifact. The continuous ebb and flow of brain activity is categorized into the brainwave spectrum, comprising distinct bands defined by their frequency ranges, each linked to different mental states. These primary categories of brainwaves include delta, theta, alpha, beta, and gamma, each dominating during different activities like sleeping, relaxing, or active thinking. Understanding this spectrum allows us to map internal states to measurable neural activity. Diving into the slowest frequencies, delta waves, characterized by a frequency range of zero point 0.5 to 4 Hz and high amplitude, are the hallmark of deep, dreamless sleep. This state, also known as slow wave sleep, is crucial for physical restoration and certain types of memory consolidation. The profound synchronization required for delta waves reflects a brain largely offline from conscious processing, engaged in essential restorative functions. Intriguingly, evidence suggests significant unconscious learning and memory consolidation occur during delta-dominant sleep, challenging the notion of it being merely inactive rest. Studies show that during slow-wave sleep, the brain replays and strengthens neural patterns associated with memories acquired during wakefulness, transferring them for long-term storage. This hippocampal neocortical dialogue, occurring beneath the veil of consciousness within delta rhythms, is crucial for solidifying what we've learned. Compelling real-world stories and clinical observations link enhanced delta activity to robust physical and psychological healing processes. For instance, growth hormone, essential for tissue repair and cell regeneration, is maximally secreted during delta sleep, underpinning the body's recovery overnight. Anecdotal and research findings also suggest that individuals reporting better sleep quality, indicative of healthy delta states, often experience faster recovery from illness and improved resilience to stress, highlighting delta's healing connection. Clinical research provides stark illustrations of delta impairment. For instance, studies consistently show that older adults with significantly reduced slow-wave sleep, the period dominated by delta waves, exhibit poorer memory consolidation compared to younger individuals or peers with healthier sleep patterns. This documented correlation highlights how disruptions in the brain's deepest sleep rhythm can manifest as noticeable cognitive deficits, particularly in retaining newly learned information. The lack of sufficient delta activity essentially impairs the brain's overnight maintenance and memory filing system, revealing a direct link between these slow oscillations and cognitive health. transitioning to slightly faster rhythms, theta waves, oscillating between 4 to 8 Hz, characterize the intriguing threshold between wakefulness and sleep, often dominating during states of drowsiness, light sleep, and deep meditation. This brainwave state is also strongly implicated in processes underlying creativity and intuitive thought, acting as a gateway to subconscious processing. Its presence signifies a shift away from external focus towards internal mental landscapes and memory retrieval. Specific neurological evidence supporting the theta creativity link comes from studies observing brain activity during problem-solving tasks requiring insight. Researchers have recorded bursts of theta activity, particularly in the brain's frontal regions like the anterior cingulate cortex, immediately preceding those sudden aha experiences or moments of creative insight. This suggests theta states facilitate the integration of disparate information and the emergence of novel solutions from the subconscious. Regarding memory formation, theta waves play a pivotal role, particularly within the hippocampus, a brain region crucial for encoding new experiences and retrieval of existing memories. The rhythmic theta oscillations are believed to coordinate neural activity, enabling the binding of different aspects of an event into a cohesive memory trace, especially for spatial memory and navigation. This hippocampal theta rhythm acts like a temporal framework for organizing information as it's learned and recalled. While direct EEG verification during peak moments is rare, consider the verified story of seasoned jazz musicians entering a flow state during improvisation, a state strongly correlated with increased theta activity. These artists often describe losing track of time and accessing a deeper wellspring of musical ideas, performing complex passages intuitively rather than through conscious effort, reflecting the characteristics of a theta-dominant state enabling peak creative performance. Their ability to seamlessly blend learned patterns with novel expression exemplifies the brain leveraging theta for spontaneous mastery. To practically encourage theta states for enhanced creativity or intuitive problem solving, one can employ specific techniques aimed at quieting the analytical mind and accessing subconscious resources. Practices such as extended mindfulness meditation, engaging in absorbing creative activities like free writing or drawing, or consciously exploring the hypnagogic state. The transitional phase, just before falling asleep, can cultivate the theta rhythm. This theta learning technique involves letting go of focused effort and allowing ideas to surface more freely. Moving up the frequency ladder, alpha waves, spanning the 8 to 12 Hz range, are most prominently associated with states of calm, relaxed awareness, and wakeful rest. They typically increase when you close your eyes and relax, signifying a state of mental quietude and disengagement from active external processing or strenuous mental tasks. This alpha state reflects a serene baseline, poised and receptive. Functionally, alpha waves often serve as a crucial bridge state between the active, externally focused conscious mind characterized by beta waves and the deeper realms of the subconscious mind dominated by theta and delta waves. By quieting the noise of active thought, the alpha state facilitates easier access to intuition, memory recall, and the suggestibility useful in meditative or hypnotic practices. It represents a transition zone where conscious awareness can begin to interface with deeper mental processes. Compelling real stories demonstrate the power of increasing alpha waves to effectively combat chronic stress and anxiety, often through neurofeedback training or dedicated meditation practices. Individuals suffering from anxiety disorders or PTSD have reported significant symptom reduction after learning to consciously boost their alpha activity, experiencing greater calm and emotional regulation. These cases underscore the direct relationship between heightened alpha rhythms and a more resilient, less reactive nervous system. The cognitive benefit of alpha is evident in learning readiness, as a relaxed alpha-dominant state is widely considered optimal for absorbing new information effectively. When the brain is not overwhelmed by stress or excessive mental chatter indicated by high beta activity, cognitive resources are freed up, making it easier to focus attention and encode new material. This relaxed alertness promoted by alpha waves minimizes cognitive load and maximizes receptivity to learning. Specific, actionable techniques exist to consciously boost alpha wave production, thereby cultivating relaxation and enhancing learning readiness. Consistent practice of mindfulness meditation, transcendental meditation, or focused breathing exercises reliably increases alpha amplitude over time, alongside dedicated alpha biofeedback training, which provides real-time feedback on brainwave activity. Even simple actions like closing your eyes and taking slow, deep breaths can temporarily shift brain activity towards the alpha range. A compelling case study involving alpha biofeedback might feature an individual suffering from chronic pain who learned to significantly increase their alpha wave amplitude through neurofeedback sessions. This patient reported not only a reduction in perceived pain intensity, but also improved mood and coping ability, demonstrating a practical benefit of self-regulating brainwaves. Such alpha biofeedback stories highlight how gaining conscious control over neural oscillations can directly impact physical and psychological well-being. Progressing to higher frequencies, beta waves, broadly covering the 12 to 38 Hz spectrum, characterize our normal waking consciousness associated with active thinking, alertness, focused mental activity, and engagement with the external world. This beta band is further subdivided into different ranges low, mid, and high beta, each linked to varying degrees of cognitive engagement and arousal. Understanding these nuances reveals much about our moment-to-moment mental state. Specifically, the low beta range, sometimes called beta 1 or sensor motor rhythm SMR, when found over the sensor motor cortex, oscillates between approximately 12 to 15 Hz. This frequency is typically associated with states of relaxed focus, light contemplation, or quiet alertness, like reading a book attentively but comfortably. Low beta signifies engaged yet calm mental processing without the agitation of higher beta frequencies. In contrast, the mid-range beta, roughly 16 to 22 Hz, is strongly linked to active concentration, focused attention, and analytical problem solving. When you're actively engaged in a task, calculating sums, debating a point, or making decisions, your brain likely exhibits prominent mid-beta activity. This state reflects a heightened level of cognitive processing and purposeful mental effort. Finally, high beta activity, oscillating rapidly between 23 to 38 Hz, is strongly correlated with heightened stress, anxiety, complex thought, and the physiological arousal characteristic of the fight or flight response. This state reflects significant mental effort, agitation, or perceived threat, mobilizing the brain for rapid reaction, but often at the cost of cognitive clarity. Sustained high beta is energetically demanding and typically accompanies feelings of overwhelm or pressure. Consider the documented instance of a highly skilled surgeon whose performance unexpectedly declined, Subsequent analysis, including EEG monitoring, revealed persistent, excessive high beta activity even during routine procedures, indicating chronic stress overload. This beta overdrive manifested as increased errors and reduced manual dexterity, hindering their renowned precision. Intervention involving stress management techniques and neurofeedback aimed at reducing high beta eventually helped restore their previous level of surgical performance. Understanding these distinct beta states allows for strategic optimization of focus during demanding cognitive tasks by aiming for the mid-range beta sweet spot associated with active concentration, while consciously managing factors that push towards taxing high beta. Techniques like structured breaks, mindfulness moments to downshift arousal, or ensuring adequate sleep can help maintain productive beta activity without succumbing to beta overdrive. This conscious regulation acts as a beta learning strategy, preventing burnout and enhancing sustained mental effort. Venturing into even higher frequencies, gamma waves, vibrating rapidly between 38-100 plus hertz, represent the fastest measurable brainwave activity and are intricately linked to higher cognitive processing, peak concentration, and moments of profound insight. These oscillations are thought to reflect the large-scale coordination of neural activity necessary for complex functions like heightened perception, intense focus, and the synthesis of information. The presence of strong gamma activity often signals the brain operating at its peak computational capacity. The gamma binding problem refers to the theoretical challenge of how our brains merge disparate sensory inputs, sight, sound, touch from different brain areas into a single, unified conscious perception, and gamma waves are a prime candidate for explaining this mechanism. Synchronized gamma oscillations across distributed neural networks may act as a temporal glue, allowing simultaneously processed information to be bound together into a coherent whole. This synchronized firing at gamma frequencies could be the key to integrated consciousness. Stories linking gamma bursts to extraordinary mental states include accounts from long-term meditators, particularly Tibetan monks studied by researchers like Richard Davidson, who exhibited remarkably powerful and sustained gamma activity during compassion meditation. These individuals often describe experiences of intense clarity, profound connection, and high-level information processing far exceeding ordinary waking consciousness. Such gamma peak experiences suggest a potential link between this frequency and expanded states of awareness or even spiritual experiences. Mounting evidence suggests that experts in various fields, from master musicians to chess grandmasters, indeed exhibit different patterns of gamma activity compared to novices when engaged in their domain of expertise. Studies have shown that experts often display more efficient and task-specific gamma synchronization, possibly reflecting a more refined and integrated neural network honed through years of practice. This difference in gamma and expertise highlights how brainwave patterns can reflect the neural underpinnings of mastery. While the science is still evolving, certain safe, evidence-based ways show potential for gamma enhancement and reaping associated cognitive benefits, primarily centered around dedicated mental training. Practices such as certain types of meditation known to induce high-amplitude gamma, engaging in cognitively demanding tasks that push mental limits, and potentially neurofeedback aimed specifically at gamma frequencies are avenues being explored. However, caution is warranted, and focusing on well-established methods like meditation is currently the most reliable approach for gamma enhancement potential. A notable study published in PNAS detailed research on Tibetan Buddhist monks with extensive meditation experience, revealing significantly higher levels of gamma wave activity both during meditation and as a baseline trait compared to control groups. This heightened gamma meditation story specifically linked the practice of non-referential compassion meditation to exceptionally strong, synchronized gamma oscillations, suggesting that long-term training in specific mental states can fundamentally alter brainwave patterns. The findings provide compelling documented evidence for meditation's ability to influence high-frequency brain activity. Specific brainwave patterns directly shape our ability to learn new and difficult things by creating distinct internal environments that either facilitate or hinder information processing and retention. For example, the relaxed alertness of alpha primes the brain for input, while focused mid-beta supports active analysis, and theta aids subconscious integration and memory encoding. Understanding this learning connection reveals that managing our brainwave state is key to optimizing the entire learning cycle. The optimal learning state likely involves a flexible dance between several brainwave states rather than a single static frequency, allowing for different phases of the learning process. An ideal combination might start with alpha for relaxed receptivity, transition into focused mid-beta for active engagement and analysis, incorporate theta bursts for creative insight and memory consolidation, and perhaps even leverage gamma for peak integration moments. Achieving efficient learning and memory retention depends on the brain's ability to fluidly shift into the most appropriate brainwave state for the task at hand. The alpha-theta learning window, representing the transitional brain state where both alpha and theta waves coexist or fluctuate, is often cited as ideal for accelerated learning and heightened creativity. This state combines alpha's relaxed awareness with theta's access to subconscious processing, memory, and intuition, creating a condition of deep receptivity and enhanced information integration. It's believed that in this liminal zone, the conscious and subconscious minds communicate more effectively, facilitating rapid absorption and novel connections. Undesirable brainwave patterns can significantly create learning difficulties. Effectively acting as overcoming learning blocks becomes necessary when these patterns dominate. For instance, excessive high beta activity, indicative of stress and anxiety, consumes cognitive resources, narrows focus inappropriately, and triggers mental rigidity, making it extremely difficult to absorb new information or think flexibly. Similarly, insufficient alpha or theta might impair the ability to relax into a receptive state or consolidate memories effectively. Consider Sarah, a university student whose severe test anxiety, manifesting as persistent high beta dominance during study sessions and exams, severely impeded her learning and recall despite diligent effort. This serves as a real, albeit anonymized example. Through brainwave awareness cultivated via mindfulness and targeted relaxation techniques learned in biofeedback, Sarah learned to consciously downshift her brainwave activity out of the anxious high beta zone into calmer alpha and focused mid-beta states. This shift directly translated into improved concentration, reduced panic, and significantly better academic performance, demonstrating how managing anxiety, high beta, unlocked her learning potential. Specific brainwave patterns play crucial, distinct roles in memory consolidation, the process of solidifying recently learned information into long-term storage, both during sleep and wakefulness. Deep sleep, characterized by slow delta waves, is essential for clearing metabolic waste and transferring declarative memories from the hippocampus to the neocortex for permanent storage. During wakefulness, hippocampal theta rhythms are critical for encoding new episodic memories, while coordinated theta/gamma activity is implicated in memory recall and integrating new learning with existing knowledge. Furthermore, compelling research highlights the crucial role of sleep quality and specific brainwave patterns in consolidating learning, demonstrating that phases rich in sleep spindles and slow-wave delta activity are essential for transferring memories to long-term storage. Studies employing targeted memory reactivation cues during sleep have shown measurable improvements in recall compared to control groups, directly linking specific sleep phases to enhanced learning outcomes. This sleep learning proof underscores that optimizing sleep is not merely rest, but an active phase critical for embedding knowledge. Building on this, intentionally training brainwave patterns through techniques like neurofeedback can directly enhance neuroplasticity, the brain's remarkable capacity to reorganize itself by forming new neural connections. By reinforcing desired frequencies associated with focus beta or insight theta slash gamma, we encourage the specific neural pathways underlying these states to strengthen, essentially guiding the brain's adaptive changes. This targeted brainwave manipulation leverages the brain's inherent adaptability, fostering structural and functional changes related to learning and skill acquisition. A compelling neuroplasticity training story involves children diagnosed with severe learning disabilities and attention deficits who underwent neurofeedback training targeting specific brainwave imbalances, often involving excessive slow-wave activity during tasks requiring focus. Documented real-world examples show significant improvements in attention, reading comprehension, and overall academic performance following sustained neurofeedback, suggesting the training helped remodel neural circuits essential for learning. These cases illustrate neurofeedback's potential to facilitate neuroplasticity and overcome developmental learning challenges. Therefore, harnessing brainwaves involves practical methods that move beyond passive understanding into active application for mastering challenging skills, leveraging the principles of neuroplasticity. Real stories abound, from musicians using alpha/theta training for creative flow to athletes employing neurofeedback for peak performance states, illustrating the deliberate use of brainwave knowledge. These techniques represent accessible pathways for individuals seeking to optimize their internal state for accelerated learning and skill acquisition. Delving deeper into one such method, neurofeedback training works by providing real-time feedback on an individual's brainwave activity, enabling them to gain conscious control over typically involuntary neural processes. Electrodes placed on the scalp measure brainwaves, which are then translated into visual or auditory signals, allowing the trainee to learn through operant conditioning how to modify their brainwave patterns towards a more desired state. This deep dive reveals a sophisticated learning process where the brain essentially learns to regulate itself based on immediate consequence information. One verified account details a professional violinist struggling with performance anxiety and technical blocks who utilized neurofeedback targeting excessive beta and insufficient alpha waves, previously making intricate passages seem impossible. Through sessions focused on cultivating relaxed alertness alpha and focus calm beta, she reported significantly reduced anxiety and enhanced motor control, enabling her to master complex musical skills that had persistently eluded her. This neurofeedback success story highlights its application for overcoming high-level skill acquisition barriers. Similarly, another documented case involved a student with diagnosed ADHD whose inability to sustain attention severely hampered academic progress. Neurofeedback sessions aimed at increasing beta activity associated with focus and reducing excessive theta activity were implemented. Pre- and post-training assessments, including standardized attention tests and teacher reports, showed significant improvements in attention span, reduced impulsivity, and, consequently, better learning outcomes in the classroom. This neurofeedback success story, Focus, provides evidence for its efficacy in addressing core attention deficits that obstruct learning. For those interested in exploring this avenue, the practical first steps to start neurofeedback typically involve finding a qualified and certified neurofeedback practitioner, often through professional directories like the Biofeedback Certification International Alliance (BCIA). An initial consultation usually includes a quantitative EEG or QEG assessment to map existing brainwave patterns and identify target areas for training, followed by developing a personalized training protocol. Prospective users must understand that neurofeedback for learning requires a time commitment and consistent participation for noticeable results. However, it is crucial to acknowledge neurofeedback limitations, potential downsides, and prevalent myths before committing to the process. The cost can be substantial, often not covered by insurance, and the required time commitment for lasting effects can range from 20 to 40 sessions or more. Results vary between individuals. The expertise of the practitioner significantly influences outcomes, and while generally safe, mild transient side effects like fatigue or headache can occur. Furthermore, beware of exaggerated claims portraying neurofeedback as a universal cure-all. Beyond technology-assisted methods, specific meditation techniques offer scientifically validated ways to beneficially alter brainwave patterns for learning, acting as accessible tools for self-regulation. Research consistently shows that practices like mindfulness meditation tend to increase alpha wave amplitude, fostering relaxed alertness ideal for absorbing information, while techniques such as transcendental meditation have been linked to increased theta activity associated with creativity and memory consolidation. These meditation brainwave effects demonstrate mind training's direct impact on neural oscillations relevant to cognitive enhancement. For instance, a notable research study investigated the effects of an 8-week mindfulness meditation program on participants' brainwave activity and cognitive performance, revealing a significant increase in baseline alpha wave power post-training. This mindfulness alpha boost story correlated the heightened alpha activity with subjective reports of reduced stress and objective measures of improved attentional focus, suggesting enhanced learning readiness. The findings provide a clear link between mindfulness practice, alpha enhancement, and a brain state more conducive to effective learning. Regarding transcendental meditation (TM), documented evidence does indeed suggest a link between regular TM practice and enhanced theta wave activity, particularly during the practice itself, but also sometimes carrying over as a trait effect. This increase in theta activity observed in some TM studies is often associated with reported experiences of deep rest alongside heightened inner awareness, potentially contributing to enhanced creativity and learning benefits like improved problem-solving skills. While more research is needed, the existing transcendental meditation theta story points towards a connection between this specific technique and brain states favorable for insight. To leverage these benefits, a simple step-by-step meditation guide specifically aimed for learning begins with finding a quiet space and sitting comfortably with an upright posture to facilitate alertness. Close your eyes gently and bring your attention to the natural rhythm of your breath, simply observing the inhale and exhale without trying to control it. When your mind wanders, gently guide it back, aiming to cultivate a state of relaxed awareness characteristic of alpha/theta brainwaves. Practice this focused attention for 10 to 15 minutes daily, setting an intention beforehand to be open and receptive to learning. Another popular method involves binaural beats, an auditory illusion created when two slightly different sound frequencies are presented separately to each ear, causing the brain to perceive a third beat at the difference between the two frequencies. The underlying science behind binaural beats suggests this perceived frequency might influence or entrain brainwaves, theoretically encouraging them to synchronize with the beat frequency through a process called a frequency following response originating in the brainstem. However, the effectiveness and reliability of binaural beats to consistently entrain brainwaves to specific desired frequencies for cognitive enhancement remains a subject of ongoing scientific debate and investigation. While anecdotal reports are numerous, credible research specifically demonstrating that binaural beats aided in learning a specific difficult subject is somewhat limited and often yields mixed results. Some studies suggest potential benefits for anxiety reduction or focus enhancement using specific frequencies like alpha or theta binaural beats, which could indirectly support learning, but robust evidence for direct improvement in mastering complex academic material via binaural beats is still lacking. Therefore, approach compelling anecdotal stories with caution until more definitive binaural beats learning study data emerges. Given the ongoing debate, if exploring binaural beats, practical guidelines prioritize safety and realistic expectations for potential focus or relaxation support. Always use stereo headphones to ensure each ear receives the distinct frequency, and start with reputable sources offering tracks targeted for specific states like alpha for relaxation or beta for focus. Keep volume moderate to protect hearing and limit sessions initially to 15 to 30 minutes in a comfortable, distraction-free environment where full alertness isn't required. Transitioning from practical use, the core of the binaural beats controversy lies in the scientific skepticism regarding reliable brainwave entrainment. Critics point to a lack of large-scale, methodologically sound studies conclusively proving that the perceived beat directly causes sustained changes in dominant brainwave frequencies beyond a temporary effect or placebo response. Furthermore, the precise neural mechanisms for the claimed entrainment effect are not fully understood, fueling the ongoing scientific criticisms and debate about their cognitive enhancement efficacy. Beyond specific techniques like beats or neurofeedback, fundamental lifestyle brainwave impact reveals how daily choices shape our baseline neural activity crucial for learning. Consistent sleep hygiene profoundly affects delta waves and spindles vital for memory consolidation, while a balanced diet rich in brain-supportive nutrients influences overall cognitive function and neurotransmitter balance, affecting various brainwave states. Similarly, regular exercise has been shown to positively modulate brainwave activity, enhancing plasticity and cognitive readiness. To actively optimize these foundational elements, implementing specific sleep hygiene how-to steps can directly enhance brainwaves for memory consolidation. Establish a strict sleep-wake cycle even on weekends to regulate your body's natural clock and create a cool, dark, quiet sleep environment to minimize disruptions promoting deeper slow-wave sleep. Critically, avoid blue light exposure from screens an hour before bed and limit caffeine or heavy meals late in the evening. Actionable steps fostering optimal conditions for sleep quality and learning. Illustrating the power of movement. One compelling exercise brainwave story stems from research linking regular aerobic exercise to increased alpha wave power and better cognitive control, particularly involving executive functions. Studies using EEG consistently show that individuals engaging in moderate, sustained physical activity exhibit enhanced brainwave patterns associated with attention and reduced mental fatigue, suggesting exercise primes the brain for cognitive function. This evidence highlights exercise not just for physical health, but as a potent tool for optimizing brain states conducive to learning. Considering these various methods, combining techniques like meditation and neurofeedback presents an intriguing possibility for achieving synergistic effects for learning. For instance, the heightened self-awareness and emotional regulation cultivated through meditation could enhance a person's ability to consciously influence their brainwaves during neurofeedback sessions. Conversely, the objective feedback from neurofeedback might help deepen meditative states or identify specific brainwave targets for meditative practice, potentially accelerating progress. Indeed, an integrated approach story can be found in case studies involving individuals recovering from traumatic brain injuries (TBI) who combine cognitive rehabilitation therapy, mindfulness meditation, and targeted neurofeedback. Reports document patients using meditation to manage frustration and improve focus, alongside neurofeedback sessions designed to normalize aberrant brainwave activity resulting from the injury. This documented case of combining multiple brainwave influencing techniques showed faster and more comprehensive recovery of cognitive functions compared to single modality treatments, overcoming a significant learning hurdle post-injury. Finally, delving into these powerful methods necessitates addressing the crucial ethical considerations surrounding technologies designed for direct brainwave manipulation for enhancement. Questions arise regarding equity of access, the potential for coercion in educational or professional settings, and the philosophical line between therapy and enhancement, potentially creating societal divides. Thoughtful discussion is needed on informed consent, data privacy related to brainwave data, and the long-term societal impact of normalizing brainwave state control technologies.